Hello and welcome to the UAB Epilepsy Center. The entire UAB Epilepsy team is excited to have you rotate with us for 1 month on the Epilepsy Monitoring Unit or on the long-term EEG monitoring service. UAB is one of the largest and oldest Level 4 epilepsy centers in the US, providing the highest level of care for patients with epilepsy and seizures. This includes epilepsy surgery, implantable devices for monitoring and treatment of seizures, cognitive behavioral therapy approaches, and new medication trials. As such, during these 2 months, you have the unique chance to learn all about the aspects of epilepsy and seizure care. We hope that at the end of these rotations, you will feel very well prepared and comfortable with the diagnosis and management of acute seizures and epilepsy in an in- and outpatient setting. Further, we hope to equip you with a solid skill set allowing you to independently read and interpret routine and long-term EEG studies to help you with common diagnosis and decision-making. All faculty at UAB Epilepsy Center chose epilepsy as a career path out of fascination and passion for this field and is enthusiastic to share their knowledge and experience with you. Yet, we will try to keep our teaching efforts focused on what is truly relevant for your future career as a board-certified neurologist. Whether you will be primarily outpatient-based in private practice or hospital-based in an academic center or private hospital. Having said that, we are always available for questions, and there's plenty of opportunity to expand your knowledge base beyond the basics and to dive further into a lot of interesting subfields of epilepsy diagnostics and care. Feel free to contact me with any questions or any concerns about your educational experience during this rotation with us. So I wanted to take a few minutes to give you an overview of this UAB Epilepsy Curriculum Orientation document that I will be emailing out to you as well. Now, as you see, there's a table of content, and I'm just going to briefly go over each section so that you guys have a rough idea where to look things up and where to go from here. So after the welcome, which you just heard, I have included an important contact information list with some helpful contact numbers here, including also the emails of the faculty. So if you need to communicate with faculty about upcoming rotations and assignments, these are the email addresses to use. Now, we've had a little bit of a turnover in our faculty lately, so this might not be the most up-to-date list, but I will make sure that all the assigned faculty emails will be on your orientation email as well. The next thing is about the curriculum structure itself. There are basically these 2 months, the LTM and the EMU block. As you can see, these are each 4 weeks, and really what it comes down to is that in general on both rotations, mornings are focused on reading and interpreting EEGs, as well as addressing any patient management questions that arise on each service. Traditionally, the afternoons are less busy, which provide you with much more time for self-directed learning, and you should be using that time to really go through the learning modules, which we're going to talk about in just a second. On the LTM service, I also wanted to give you at least a kind of a slight feeling of the outpatient world and epilepsy care. So at least 1/2 day a week, we want you to rotate with our faculty in the outpatient setting. I will tell you a little bit more about that in just a second. So the epilepsy learning modules are all hosted or harbored on the HealthStream platform, all of which you should have access to by using your Blazer ID and the password and the login for the Blazer ID. I will be assigning each and every one of you all the learning modules that are listed here. Now, there are 14 of them that we are considering mandatory. So over the entire 2 blocks, the LTM and EMU block, I would like for you to do all 14 mandatory learning modules. Technically, you should have enough time to do a few more, and those are listed down here. They're recommended without any particular order. The other ones are in a pretty much logical order. Now, there is one that you see up on top here, which is the pre-rotation self-assessment. That's actually a 50 multiple choice question exam that I want you to take really before you actually start one of your rotations with us. It will cover basically all these topics here, and you will get a sort of a correct and incorrect answer sheet and sort of a pointer or hint towards which field these particular questions are covering. And so if you take that, it's a kind of a nice way to assess your own knowledge at the beginning of the rotation, but it also will help you identify any particular learning or knowledge gaps that you really want to focus on. And you will have, hopefully, a learning module to kind of address those gaps. Now, each learning module basically consists of 1 to 2 review papers on the learning module topic. And I really recommend you to kind of download them. They're really good reference material for wherever you want to go afterwards. There will be a pre-recorded lecture on each of these topics. It can range anywhere from 30 to 60 minutes, so with the lengthier ones, bear with us, but they're really high yield and good in content. And then there will be a dedicated self-assessment that can be varying anywhere from 8 to up to 20 questions. If it's sort of an EEG-based learning module, there might be a little bit more questions and sub-questions. Now, the self-assessments are targeted to cover both the review papers as well as the lecture material, and they hopefully, most of them are clinically based and case-based, so I hope you will kind of find that kind of rewarding towards the end of the learning module. And then each learning module has a brief section of evaluation, so I really hope you guys honestly evaluate that and maybe leave me a comment so that we can improve learning modules for future residents coming through. Now, the outpatient clinics, again, this roster will change a little bit as we have new faculty coming in. But in general, this is sort of the faculty schedule assigned. You should be able to kind of identify who has clinics and what kind of patients scheduled yourself and impact, but I will try to do this ahead of time and assign the LTM resident each of faculty to rotate and shadow with. There is a nice guideline on how to use sort of the video and phone visits and how to kind of invite patients and your faculty, and so I hope that might help you kind of smoothen that over. And then there is a really nice sort of succinct summary of how we approach our patients in the epilepsy clinic, the new patients as well as the follow-up patients, where we kind of pay attention to what our exam is really focusing in on and why. And that should be kind of a nice guideline for you so that once you read that, you can kind of hit the ground running as you rotate with us. There is also a helpful table about anti-seizure medication abbreviations. We use that all the time, so that's kind of nice to have if you have questions when you read up on some patients. And then finally, there is sort of a job description, and for each of the services, sort of an overview, where you need to go, what to expect, and then how the team is structured and what your responsibilities are during each of these rotations. So that's a lot of text to read through. So I'm not going to read all of that one step at a time, but please review that on each section depending on where you're assigned. And let's see, there's a little bit of a guideline on how to for the LTM person, but also for the EMU person, how to search the NATOS database to find your patients and how to kind of start looking through EEGs and sort of annotating and these kind of things. And then last but not least, there is an EEG interpretation sheet, which I highly recommend you to print out, especially when you're on the LTM service. That you can kind of write the patient name, MRN, and then really it kind of structures your review and you have it sort of neatly written there, and you can easily just check off each and every one that you staff with your faculty member. Later in the rotation, they will potentially ask you to write reports on your own, which makes this a little bit redundant, but for the first week or two, I think this is a really helpful way to structure your approach and document your findings. Now this schedule here is going to come to an end, as you see, in September, so that will be updated as well as we kind of go through the academic year. And that's pretty much about it. So if you guys have any questions, by any means, just email me. It's wmolhofer@uabmc.edu, or you can also just text me. My cell phone number is also listed up in here. It's 585-955-3787, and you can always sort of, try to get in touch with me that way. I'm here to really make this as most of a high yield experience for you as possible, and I hope you guys enjoy your time with us. We certainly are looking forward to working with all of you. All right, that would be it. Thank you.